Welcome back to AM Northwest. Here to tell us about a treatment that can take years off your looks, we welcome back from Aesthetic Medicine, Dr. Jerry Darm, along with one of his patients, Geta Werner. Nice to have you here. Yes, it is Argyle. Yeah, we were talking during the break. Good to have you back. Let's talk about we're talking about LipoFill today, and Dr. Darm, explain for our audience what LipoFill is.
Well, LipoFill is a natural filler. In essence, you take some of your fat from someplace, the thighs or the tummy, and you put it back into your face. Many patients use fillers that are, artificially manufactured, and a cc or 2 or 3 can cost thousands and thousands of dollars and only last for 6 months to a year.
Help me for a moment here, because this is a question I've had throughout my life. How much is a cc? I mean, volume-wise, what are we talking about?
Cc is just a very small
amount, right?
Very small. And so, but if you're taking your own fat from your tummy or what have you, you could do 25 cc's or 30 cc's. So most of us have a lot.
And these fillers are used in places where maybe you have deep lines or lines in your face, under
the
eye.
lines, the nasolabial folds can be done. The scowling lines here can be done. Cheeks can be filled in here, and so as we age, our face becomes more like Mr. Peanut, basically, and sinks in, and so that we need filler. All of us need filler.
And you had the procedure done. Now we have some pictures of your procedures, but I can't imagine you had anything done. You look perfect to us here.
You.
But let's take a look at the before and after pictures here, and obviously we can see a big difference.
Her nasolabial folds were done. The cheeks were done, and they're much more full, and it's a very natural look. And the thing is, it's you. It's just taking part of you and transferring it into another place. Called fat transfers is another
fat transfers.
Fat grafts.
Yeah, you weren't difficult to look at before the procedure.
Thank you.
But it does change the appearance. You look younger. What have your friends, your family said to you?
They asked me, have I been on a vacation? I go, yeah, well, okay. I've rested, but in the beginning, I just wanted to see if they've noticed, but people noticed that my cheeks are fuller and my eyes they say that even my nose appears smaller.
Oh, there you go. And how long does this last?
Well, it can last years and years, and so generally speaking, longer than the artificial fillers that are put in. But it could last a lifetime in some of the people.
Was it painful?
No.
Not at all. No. So the idea is you find fat anywhere else on the body that you want, right?
Well, that you don't want.
Yeah, you have told me many times where I'm fat, but I'm talking about for the procedure. Is it belly fat usually?
Usually it's belly fat.
Yeah. And then it's just injected in there, and it wasn't painful, no real downtime?
No downtime. There was some swelling for about a week and a half, but I still went out, shopping.
And people didn't notice?
They noticed. They asked, bruising, been in a car accident. I said, no, just a little work here and there, my face.
Yeah, and now it's just perfect. And you say so it'll last for years, and so how long is the procedure if you want to have some lines filled in,
It'll take about an hour, and very comfortable, and we use, if you want, we can use a little bit of IV anesthetic, for example, so it can be painless to do. A little firmness afterwards, but possibly a little bruising, but not bad. And of course, you're not going to have a reaction to your something
so
that's from
it's
your
far
own
more
body.
natural than anything else out there, isn't it?
Exactly.
Very good. If you'd like to find out more information, Aesthetic Medicine in Lake Oswego on Meadows Drive. Their phone number is 503-697-9777, and we'll have more information too on our website at KA2.com. Thanks for coming and sharing that with us. Good to see you again as well.
Nice sweater.
Yeah. Okay. Thank you very much.
The neck, though.
Yeah, we'll get the neck done someday.
All right.